HY review. Ethics and professionalism. 40 questions on the material that shows up more every year. On step 1 and step 2, consent, capacity, confidentiality, end of life, and how to act like a professional. Read the scenario, find the principle, commit, and move. Clock starts now. Which ethical principle governs this fair allocation? During a severe organ shortage, a transplant committee must decide how to allocate a single donor liver among several candidates. They rank patients by medical need and likelihood of benefit, explicitly refusing to favor wealth or celebrity. Read the command. The principle behind fair allocation of a scarce resource. Distributing fairly is justice. Justice is the principle of fair distribution, allocating scarce resources like a donor organ by legitimate criteria such as medical need and expected benefit, not by wealth, status, or favoritism. Whenever the question is who gets a limited resource and on what fair basis, justice is the governing principle. The correct answer is B. Beneficence is acting in an individual patient's best interest, not deciding how to divide a limited resource fairly among many. Choice C wrong. Autonomy concerns a patient's right to make their own decisions, which is not what a committee's allocation policy is about. Choice A wrong. Fair allocation of a scarce resource is governed by justice. Which principle is she primarily invoking? A physician considers ordering an invasive test whose potential benefit is small, but whose risk of serious harm is high. She decides against it, explicitly reasoning, first, do no harm. Read the command, the principle behind. First, do no harm. Avoiding harm is non-maleficence. Non-maleficence is the duty to avoid harm. The classic first, do no harm, when the emphasis is on not inflicting a harm that outweighs a small benefit, as with a dangerous low-yield test, non-maleficence is the principle at work. It is closely related to beneficence, but points specifically at avoiding injury rather than doing good. The correct answer is beneficence is the duty to actively do good and promote the patient's welfare. The reasoning here centers on avoiding harm, which is the non-maleficent side of the same coin. Choice D wrong. Autonomy concerns the patient's right to choose, not the physician's calculus of harm versus benefit. Choice A wrong. Declining a harmful low-benefit test invokes non-maleficence. What justifies proceeding without explicit consent? An unconscious man is brought to the emergency department with life-threatening internal bleeding. He has no family present and no advance directive, and he cannot communicate. He needs immediate surgery to survive. Read the command. What lets you operate without explicit consent? In a life-threatening emergency, consent is implied. In a life-threatening emergency, when the patient cannot consent and no surrogate is available, consent is impaired. We presume a reasonable person would want life-saving treatment. This emergency exception lets the team proceed immediately because waiting would cause serious harm or death. The correct answer is A. Therapeutic privilege is about withholding information from a patient who could otherwise decide, not about acting in an emergency. Choice B wrong. Substituted judgment requires a surrogate applying the patient's known wishes, which are unavailable here since no one knows him. Choice D wrong. Emergency implied consent justifies proceeding. What is this narrow exception called? In a rare and carefully justified situation, a physician temporarily withholds one piece of information because disclosing it at that moment would so destabilize the patient, for example, precipitating a suicide attempt, that it would undermine the patient's very ability to decide. Read the command, name the exception where the physician withholds harmful information. That is therapeutic privilege. Therapeutic privilege is a rare, narrow exception in which a physician withholds information because disclosing it would cause serious, direct harm to the patient, harm severe enough to undermine their decision-making. It is controversial and used cautiously. never merely to avoid an uncomfortable conversation or to steer a choice. The correct answer is C. A waiver is when the patient voluntarily chooses not to be informed, the reverse of the physician withholding information, choice A wrong. The emergency exception covers acting without consent when a patient cannot decide, not the selective withholding of information from a patient who otherwise can, choice E wrong. A physician withholding harmful information is therapeutic privilege. What is this, and is it acceptable? A competent patient tells his physician before a procedure, "I trust you completely. I really don't want to hear the risks or the details. Just do what you think is best." He knowingly chooses not to be fully informed. Read the command. Name what the patient is doing and whether it's valid. A competent patient may decline to be informed. A competent patient may knowingly waive the right to detailed disclosure, choosing not to hear the risks and delegating the decision to the physician. This is a valid waiver of information, as long as the patient understands they are giving up that information voluntarily. Autonomy includes the freedom to decline information, not just to receive it. The correct answer is D. Therapeutic privilege is the PHY-cission, withholding information to prevent harm. Here, it is the patient who chooses not to be informed, choice A wrong. The consent is not invalid. A knowing voluntary waiver is an accepted exercise of autonomy, not a defect, choice B wrong. A competent patient declining disclosure is a valid waiver. What type of consent is demonstrated during a routine clinic visit when the nurse approaches with a needle and tube to draw blood? The patient rolls up his sleeve and extends his arm. No separate consent form is signed. Read the command. The type of consent shown by cooperative behavior. Rolling up the sleeve implies agreement. A monthly consent is agreement shown through a patient's cooperative conduct rather than a signed form. Here, extending the arm for a routine, low-risk blood draw. For everyday minor procedures, this behavioral consent is sufficient. Formal written consent is reserved for higher-risk interventions like surgery. The correct answer is B. Written informed consent is not required for a routine venipuncture. It is reserved for higher-risk procedures, so demanding it here misjudges the situation. Choice A wrong. This is not an emergency, so emergency consent, which applies when a patient cannot consent and faces life threatening harm, does not fit, choice D wrong. Cooperating with a routine draw is implied consent. What is required for a valid informed refusal? A competent patient declines a recommended screening colonoscopy. The physician wants the refusal to be as valid and well documented as a consent would be. Read the command. What makes a refusal valid? It mirrors informed consent. The patient must understand the consequences. I-informed refusal is the mirror image of informed consent. A competent patient may decline a recommended test or treatment, provided they understand the risks and consequences of not proceeding. The physician's job is to ensure and document that understanding, not to force the patient or seek an outside sign-off. The correct answer is a psychiatric evaluation is not required simply because a competent patient declines a recommended test. Disagreement is not evidence of impairment, choice C wrong. Family agreement is irrelevant for a competent adult who decides for himself, choice B wrong. A valid refusal requires that the patient understands the risks of refusing. What should the surgeon do? During a consented appendectomy, the surgeon discovers an unexpected ovarian mass that is not immediately life-threatening and was never discussed or consented for. The patient is under general anesthesia. Read the command, how to handle an unconsented, non-urgent finding mid-surgery. No emergency means no authority to go beyond the consent. Consent covers only the agreed-upon procedure. Because the ovarian mass is not an emergency, the surgeon has no authority to remove it without the patient's consent. The right course is to finish the consented operation, then discuss the finding with the patient once she is awake, so she can make an informed decision. Operating beyond consent without an emergency is battery. The correct answer is C. Removing the mask now, without consent and without an emergency, exceeds the scope of what the patient authorized and constitutes battery choice or wrong. The family cannot consent for a competent adult who can simply be asked herself once she wakes up, choice E wrong. The surgeon should close and discuss the finding with the patient later. What does this illustrate about capacity? A patient with mild cognitive impairment clearly understands and agrees to a simple blood draw, but cannot grasp the risks and alternatives of a complex heart operation. Read the command. What this shows about capacity. Capacity depends on the specific decision. Decision-making capacity is decision. Specific. A patient can have enough capacity for a simple, low-stakes choice while lacking it for a complex, high-risk one. It is not global or fixed. It is judged against the particular decision at hand and can even change over time. So, this patient can consent to the blood draw, but not the surgery. The correct answer is A. Capacity is not all or nothing. Treating it as a single global switch ignores that it varies with the complexity of the decision. Choice D wrong. He does not lack ALL capacity. He clearly has it for the simple blood draw. Choice B wrong. This scenario illustrates that capacity is decision specific. How should his capacity be handled? A hospitalized patient with delirium is confused and disoriented every evening but lucid and coherent each morning. A non-urgent decision about an elective procedure is needed. Read the command, how to handle fluctuating capacity. Delirium waxes and wanes, so assess when he is clear. Delirium causes capacity to fluctuate, clear in the morning, confused at night. Because the decision is not urgent, the right approach is to assess capacity and obtain consent during a lucid interval, when the patient can genuinely understand and decide. Delirium is often reversible, so his incapacity is not necessarily permanent. The correct answer is D. Declaring him permanently incapable ignores that delirium fluctuates and is frequently reversible, so his incapacity is not fixed. Choice are wrong. Having the family sign immediately bypasses a patient who may soon regain capacity and decide for himself. Choice B wrong. Assess capacity during a lucid interval. How should his refusal be regarded? A patient with schizophrenia that is currently well controlled. He is not psychotic and reasons clearly, refuses an elective surgery after understanding the risks, benefits, and alternatives. Read the command, how to treat a stable psychiatric patient's refusal. A diagnosis alone does not remove capacity. A psychiatric diagnosis does not automatically strip capacity. What matters is whether the patient can understand, appreciate, reason, and communicate a choice, and this stable, non-psychotic patient does. Therefore, he retains capacity, and his informed refusal must be honored just like any competent patient's. The correct answer is C. Psychiatric illness does not by itself remove capacity. A stable reasoning patient can still make valid decisions. Choice A wrong. Overriding him simply because he carries a mental illness label substitutes the diagnosis for an actual capacity assessment, which is not permitted. Choice B wrong. He retains capacity, so honor the refusal. Who is the decision maker? An incapacitated woman had previously signed a document naming her best friend as her healthcare power of attorney. Her estranged husband now appears and demands to make her medical decisions as next of kin. Read the command, who decides when a named proxy conflicts with next of kin. A designated proxy outranks the default hierarchy. When a patient has designated a healthcare power of attorney, that proxy speaks for her and overrides the default surrogate hierarchy, including the spouse. Because she explicitly chose her best friend while she had capacity, the friend, not the estranged husband, is the legitimate decision maker. A patient's own designation trumps the standard next of kin order. The correct answer is B. The husband would decide only under the default hierarchy, which applies when no proxy was named, but here the patient specifically appointed someone else, choice or wrong. Adult children also fall within that default order, which the designated proxy supersedes choice D wrong. The designated healthcare power of attorney is the decision maker. What is the appropriate approach? An incapacitated, unbefriended patient has no advance directive, no family, and no designated proxy. A major non-emergent treatment decision must be made. Read the command how to decide for a patient with no surrogate. Use the best interest standard with institutional safeguards. When a patient has no advance directive, no family, and no proxy, decisions default to the BES-10 standard. What a reasonable person would want, apply with institutional safeguards such as an ethics committee and sometimes a court-appointed guardian. This protects the vulnerable patient from a single person's unchecked judgment. The correct answer is a physician deciding alone and in private lacks the oversight needed to protect a patient who has no advocate. Safeguards like an ethics committee exist precisely for this choice B wrong. Waiting indefinitely for a surrogate who may never come would harm the patient by delaying a needed decision, choice D wrong. Decide by best interest with the ethics committee. Which standards should the surrogate use? An incapacitated patient never expressed any preferences about medical care and left no advance directive. A surrogate must now decide about a treatment on his behalf. Read the command. The standard, when the patient's wishes are unknown, decide what a reasonable person would want. When a patient's wishes were never known and there is no directive, the surrogate uses the best interest standard, choosing what a reasonable person would want, weighing benefits and burdens. This is the fallback precisely because substituted judgment is impossible without any knowledge of the patient's values. The correct answer is A. Substituted judgment requires canine wishes or values to reconstruct what the patient would have chosen. Impossible here, since he never expressed any choice B wrong. The physician's personal preference is never the standard. Decisions must center on the patient, not the doctor choice E wrong. With unknown wishes, use the best interest standard. Does the living will apply here? A patient's living will states he wants no mechanical ventilation if I am terminally ill or permanently unconscious. He is now hospitalized with a reversible pneumonia and would need a ventilator only briefly to recover fully. Read the command whether the living will triggers. Read its conditions. Reversible pneumonia is neither terminal nor permanent unconsciousness. A living will applies only under the specific conditions it names, here being terminally ill or permanently unconscious. A reversible pneumonia is neither, so the document does not trigger and the patient should receive the short course of ventilation needed to recover. Directives are read against their stated conditions, not applied blindly to every situation. The correct answer is D. Refusing to ever ventilate him applies the directive outside its stated scope, ignoring that the pneumonia is reversible and not a terminal or permanent condition, choice, or wrong. A living will does not always apply, regardless of circumstances. It is bound by the conditions it specifies, choice, B, wrong. The conditions are not met, so the living will does not apply. Who provides consent? A 17-year-old who is legally married and financially independent needs consent for a non-emergency surgery. Read the command. Who consents for an emancipated minor? He decides for himself. An emancipated minor, one who is married, in the military, financially self-supporting, or declared emancipated by a court, may consent to their own medical care just like an adult. Because this 17-year-old is married and financially independent, he provides his own consent and parental authority no longer applies. The correct answer is B. Parental consent is not required once a minor is emancipated, since emancipation removes parents' decision-making authority, choice, or wrong. Waiting until age 18 ignores that emancipation grants adult decision-making rights early, choice E wrong. An emancipated minor consents for himself. Which doctrine may let her consent? A 16-year-old who is not emancipated demonstrates clear maturity and understanding about a specific medical decision, and her jurisdiction recognizes such minors as able to consent for certain care. Read the command, the doctrine for a mature but non-emancipated minor. Maturity for the specific decision can allow consent. The mature minor doctrine allows a non-emancipated minor who is judged mature enough to understand a specific decision to consent to that care, where the law recognizes it. Unlike emancipation, it is not a fixed legal status. It depends on the minor's demonstrated maturity for the particular decision at hand. The correct answer is C. Emancipation is a formal legal status. Married, self-supporting, court declared that this minor does not have. She is being judged on maturity, not status choice. A wrong. Substituted judgment is about deciding for an incapacitated patient based on their known wishes, unrelated to a competent minor consenting choice. D wrong. Her situation invokes the mature minor doctrine. What is generally required? A 14-year-old who is not emancipated wants an elective, non-emergency procedure that does not fall under any confidential care exception, such as STI, contraception, pregnancy, or substance use. Read the command. What's needed for routine non-exception care in a minor? Default rule is parental consent. For ordinary non-emergency care that does not fall under a confidential exception, the default rule for a non-emancipated minor is parental consent. The special categories where minors self-consent, STI care, contraception, pregnancy, substance use, and emergencies are exceptions. Anything outside them reverts to needing a parent. The correct answer is a minor self-consents only for the specific confidential exceptions or emergencies, none of which apply to this elective procedure. Choice A wrong. Confidential treatment without a parent is likewise reserved for those exception categories, not routine elective care. Choice C wrong. Routine care for a young minor requires parental consent. What should be done? The parents of a 5-year-old with life-threatening anemia refuse a life-saving blood transfusion on religious grounds. Without it, the child will die. Read the command. What to do when parents refuse life-saving care for a child. Parents can't refuse life-saving treatment for a child. Adults may refuse treatment for themselves, but they may not refuse life-saving treatment for their child. When parental refusal endangers a child's life, the physician acts to protect the child, giving the transfusion and obtaining an emergency court order. The child's right to life overrides the parent's religious objection. The correct answer is A. Respecting the refusal is appropriate only when a competent adult refuses for himself. It does not extend to letting a child die. Choice B wrong. A 5-year-old is far too young to consent, so waiting for the child to decide is not an option. Choice D wrong. Give the transfusion and seek a court order. What is the physician's obligation? A court issues a valid court order, subpoena, for a patient's medical records as part of a legal proceeding. The patient has not authorized their release. Read the command. The duty when a court legally compels records. A valid court order is an exception to confidentiality. A valid court order is a recognized legal exception to confidentiality. When a court lawfully compels the release of records, the physician must comply, disclosing what the order requires. Confidentiality protects patients from voluntary disclosures, but it yields to a legitimate legal mandate. The correct answer is D. Refusing entirely defies a lawful court order. Confidentiality does not shield records from a valid legal mandate. Choice A wrong. The patient's consent is not required when disclosure is legally compelled by a court. Choice E wrong. The physician must comply with the valid court order. What is required? Physician evaluates a toddler with spiral fractures and bruises whose pattern is clearly inconsistent with the parent's explanation. The physician strongly suspects abuse but has no definitive proof. Read the command, the duty on suspected child abuse. Reasonable suspicion is enough to report. Physicians are mandated reporters of child abuse. A reasonable suspicion is enough. You do not need proof. Injuries inconsistent with the history meet that threshold, so the physician must report to Child Protective Services, who investigate. Reporting in good faith is legally protected, and confidentiality does not apply to suspected child abuse. The correct answer is B. Waiting until abuse is proven dangerously delays protection. The legal duty triggers on suspicion, not certainty, choice, or wrong. Keeping it confidential ignores that mandatory abuse. Reporting overrides confidentiality, choice, E, wrong. The physician must report the suspicion to Child Protective Services. What should the physician do? A competent adult woman confides that her partner hits her, but she asks the physician not to report it or intervene. In this jurisdiction, there is no mandatory reporting law for intimate partner violence against a competent adult. Read the command, how to handle IPV in a competent adult who declines reporting. Respect her autonomy, support her. Unlike child or dependent elder abuse, intimate partner violence against a competent adult is generally not mandatory to report where no such law exists. The physician must respect her autonomy. She decides whether to report or leave. The right role is to offer resources, safety planning, and non-judgmental support, not to act against her wishes. The correct answer is reporting to police against her wishes overrides the autonomy of a competent adult where no reporting law compels it. The opposite of child abuse, which is mandatory choice, A, wrong. Forcing her into a shelter likewise removes her choice and can endanger her further, choice, C, wrong. What does the DNR order mean for his care? A hospitalized patient has a valid do not resuscitate DNR order. He then develops a bacterial pneumonia that is readily treatable with antibiotics. Read the command. What a DNR does and does not cover. It only limits CPR, nothing else. A DNR order means only that cardiopulmonary resuscitation will not be attempted if the heart or breathing stops. It does not limit any other appropriate care. The patient should still receive antibiotics for his pneumonia, along with all other indicated treatment. DNR is narrow. It is not a decision to withhold everything. The correct answer is C. Withholding ALL treatment misreads a DNR as a blanket order to do nothing, when it applies only to resuscitation, choice, or wrong. Providing comfort care only would be appropriate under a separate comfort care order, not simply because a DNR exists, choice, E, wrong. A DNR means no CPR, but all other appropriate treatment continues. Is the physician obligated to provide it? The family of a dying patient demands an intervention that offers no physiological benefit and cannot achieve the goal they hope for. For example, CPR when death is imminent and irreversible. Read the command. Whether futile treatment must be provided. Physicians need not offer non-beneficial care. Medical futility means an intervention cannot achieve its physiological goal or offers no benefit. Physicians are not obligated to provide futile treatment, even if a family demands it. Patient autonomy is a right to refuse unwanted treatment. It is not a right to compel a physician to deliver care that cannot help. The correct answer is A. The family's wishes are not binding when the requested treatment is futile. Surrogates cannot compel non-beneficial care. Choice B, wrong. Autonomy grants the right to decline treatment, not a right to demand any intervention regardless of benefit. Choice C, wrong. Physicians are not obligated to provide futile treatment. What is this called? A terminally ill, competent patient in a jurisdiction that permits it asks his physician to prescribe a lethal dose of medication that the patent will then take himself to end his life. Read the command. Name the act where the physician prescribes but the patient self-administers. That is physician-assisted death. In PHY session, assisted death, the physician provides the means of prescription, but the patient takes the final action of self-administering. The distinguishing feature is WHO performs the lethal act, the patient. This differs from euthanasia, where the physician is the one who administers the lethal agent. The correct answer is D. Active euthanasia is when the PHY session directly administers the lethal agent, such as a lethal injection. Here, the patient administers it himself, choice or wrong. The doctrine of double effect involves giving proportionate pain relief that may foreseeably hasten death, with the intent to relieve suffering, not to cause death, choice C, wrong. A physician prescribing while the patient self-administers is physician-assisted death. What is his legal status? A patient has irreversible cessation of ALL brain function, including the brainstem, no brainstem reflexes, and a positive apnea test. His heart continues to beat only because a ventilator supports him. Read the command. The status with irreversible whole brain failure. Whole brain death is legal death. Brain death, the irreversible loss of ALL brain function, including the brainstem, is legally equivalent to death, even while the ventilator keeps the heart beating. A brain-dead patient is legally dead, so the ventilator may be discontinued and organ donation can proceed. This is fundamentally different from a persistent vegetative state, where the brainstem still works. The correct answer is C. A persistent vegetative state preserves brainstem function, sleep-wake cycles, and reflexes remain, so such patients are alive, unlike this brain-dead patient choice, A, wrong. A coma is a state of a living patient with some brain function, not the irreversible whole brain loss described choice, B, wrong. Irreversible whole brain failure is brain death, which is legal death. How should this be handled? A patient who is now brain dead had registered as an organ donor on his driver's license while he had capacity. After his death, his grieving family objects to the donation. Read the command whose decision governs organ donation. The patient's own registered decision stands. The patient's own registration as an organ donor is first person authorization and is legally binding. It represents the patient's autonomous decision, which the family generally cannot override. The team honors the registered wish. Separately, the transplant team is kept distinct from the team that cared for the dying patient to avoid any conflict of interest. The correct answer is B. The family's objection does not cancel a valid first-person donor registration, which reflects the patient's own autonomous choice, choice A, wrong. The spouse's authorization is not required when the patient already registered as a donor himself, choice E, wrong. Honor the patient's registered donor decision. What is the primary goal of hospice? A patient with terminal cancer and a prognosis of under 6 months chooses to enroll in hospice care. Read the command. The goal of hospice. Comfort and quality of life, not cure. Hospice and palliative care focus on comfort and quality of life for patients near the end of life, controlling pain and symptoms, rather than pursuing cure. Hospice neither tries to cure the underlying disease nor deliberately hastens death. It lets the natural course proceed while maximizing comfort. The correct answer is aggressive, curative treatment is the opposite of hospice, which is chosen precisely when cure is no longer the goal, choice A, wrong. Hospice does not hasten death. It neither prolongs nor shortens life, but focuses on comfort, choice C, wrong. Hospice aims at comfort and quality of life rather than cure. Is stopping it permissible? A competent, terminally ill patient asks that his artificial nutrition and hydration through a feeding tube be stopped. He understands this will shorten his life. Read the command. Whether artificial nutrition can be stopped at the patient's request. It is a treatment a competent patient may refuse. Artificial nutrition and hydration are legally considered medical treatment, not obligatory basic care. A competent patient may refuse them just like any other treatment, a ventilator, dialysis, or medication. Honoring that refusal lets the disease take its course and is not euthanasia, because the physician is respecting an autonomous choice, not acting to cause death. The correct answer is D. Calling it basic care that can never be stopped is incorrect. Courts and ethics recognize artificial nutrition as a medical treatment subject to refusal. Choice A. Wrong. Stopping an unwanted treatment is not euthanasia, which requires an act intended to cause death rather than honoring a refusal. Choice B. Wrong. It is a medical treatment the competent patient may refuse. What is the physician's ethical obligation? A physician who personally owns a large amount of stock in a drug company is invited to present research on that same company's drug at a medical conference. Read the command. The duty when a financial interest overlaps with the work. Transparency. Disclose it. A conflict of interest arises when a personal interest, here owning the company's stock, could bias professional judgment. The ethical duty is transparency, disclose the conflict to the audience and relevant parties so they can weigh the work accordingly. Disclosure, not concealment, preserves trust. The correct answer is A. Hiding the relationship to appear objective is the opposite of the required transparency and erodes trust if later discovered. Choice B. Wrong. Doing nothing because stock ownership is legal confuses legality with the ethical duty to disclose a potential bias. Choice E. Wrong. The obligation is to disclose the financial conflict of interest. What should the physician do? A pharmaceutical representative offers a physician an expensive gift and an all-expenses-paid luxury vacation in the hope of encouraging the physician to prescribe the company's drug. Read the command, how to handle a lavish industry gift. Decline. It is a conflict of interest. Substantial gifts from industry, especially expensive items or trips meant to influence prescribing, create a conflict of interest and can bias clinical decisions, even unconsciously. The physician should decline them. Accepting such inducements compromises objectivity and the primacy of the patient's interest. The correct answer is C. Calling such gifts harmless ignores the well-documented influence they exert on prescribing, even when physicians believe they are immune. Choice A. Wrong. Accepting the gift and prescribing more is exactly the conflicted behavior. The rule against industry gifts is meant to prevent. Choice D. Wrong. The physician should decline the gift. How should the physician respond? After a successful recovery, a grateful patient brings her physician a small homemade token of thanks, a plate of cookies she baked. Read the command, how to handle a small gift from a patient. A modest token can be graciously accepted. Small, modest tokens of gratitude from patients, like homemade cookies, may be graciously a CCC accepted, since they are a normal expression of thanks and refusing could seem cold. The line is drawn at large or expensive gifts or anything that could create an obligation or impaired judgment, which should be declined. The correct answer is B. Refusing all gifts on principle is unnecessarily rigid and can insult a patient's sincere, modest gesture. Choice A. Wrong. Accepting a large cash gift crosses the line into a gift that could impair judgment or create obligation and should be declined. Choice D. Wrong. A small token of thanks may be graciously accepted. What is the appropriate action? A physician notices that a colleague repeatedly smells of alcohol and appears intoxicated while on duty, putting patients at risk. Read the command, The duty about an impaired colleague. Patient safety first. Report. An impaired colleague who endangers patients must be reported to a supervisor, the chief of staff, or a physician health program. The overriding duty is patient safety. Physician health programs exist to help the impaired physician get treatment while protecting patients. Looking the other way betrays both. The correct answer is ignoring it to protect the colleague leaves patients exposed to a demonstrably unsafe physician, violating the duty to patients. Choice or wrong. Waiting until a patient is actually harmed abandons the preventive purpose of reporting impairment. Choice C, wrong. Report the impaired colleague to a supervisor or physician health program. What should she do? A physician realizes that a medication error under her care has harmed a patient. Read the command, the duty after a harmful error, honest disclosure and apology. When a medical error harms a patient, the physician has an ethical duty of honesty. Disclose the error to the patient, explain what happened, and apologize. Transparency respects the patient's autonomy and trust, supports safety improvements, and is the right thing to do regardless of liability fears. The correct answer is D. Hiding the error to avoid a lawsuit is dishonest, violates the patient's right to know, and erodes trust further if uncovered. Choice or wrong. Altering the chart to remove the mistake is falsification of the medical record, fraud on top of the original error. Choice E, wrong. The physician should honestly disclose the error and apologize. What is the correct professional boundary? A physician develops a romantic attraction to a current patient and wonders whether it would be acceptable to begin a sexual relationship with her. Read the command, the boundary about relationships with current patients. Never acceptable. A sexual or romantic relationship with the current patient is never acceptable. The inherent power imbalance and the patient's vulnerability make true consent impossible and exploit the physician's position of trust. It is a fundamental boundary violation, regardless of who initiates it. The correct answer is A. Mutual consent does not make it acceptable because the power imbalance in the physician-patient relationship undermines the voluntariness of that consent. Choice B, wrong. The patient initiating it does not lift the prohibition. The responsibility to maintain the boundary rests with the physician. Choice E, wrong. A relationship with a current patient is never acceptable. Which set correctly lists the 4 required elements, the 4 Ds. To succeed in a medical malpractice negligence claim, a plaintiff must prove 4 specific elements. Read the command. The 4 elements of malpractice: duty, dereliction, damages, direct cause. Medical malpractice is a form of negligence, and the plaintiff must prove all 4 Ds. A duty of care existed. There was dereliction when a breach of that duty. The patient suffered damages, and the breach was the direct cause of those damages. Missing any one element defeats the claim. The correct answer is C. The list of duty, disclosure, diagnosis, and death mixes in terms that are not the legal elements of negligence. Choice A, wrong. Consent, capacity, causation, and care describe other ethical and legal concepts, not the 4 elements of a malpractice claim. Choice D, wrong. Malpractice requires duty, dereliction, damages, and direct causation. Which defense mechanism is this? A married man has an unconscious attraction to a coworker, which he finds unacceptable in himself. Instead of recognizing it, he becomes convinced, without evidence, that his wife is the one being unfaithful. Read the command, name the defense mechanism. He attributes his own forbidden impulse to someone else. PR. Objection is attributing one's own unacceptable feelings or impulses to someone else. Unable to accept his own attraction, the man assigns unfaithfulness to his wife instead. The hallmark is taking an internal, forbidden feeling and seeing it in another person, which relieves the anxiety of owning it. The correct answer is B. Displacement redirects an emotion onto a safer target, like yelling at the kids after a bad day at work, rather than attributing the feeling to someone else. Choice or wrong. Denial is refusing to accept an external reality altogether, not relocating a feeling onto another person. Choice E, wrong. Attributing his own impulse to his wife is projection. How is this best characterized? 3 weeks after her husband's death, a widow has waves of sadness and tearfulness, and once briefly thought she heard his voice in the house. She knows he has died, continues to care for herself, and is gradually resuming daily activities. Read the command. Normal grief versus a disorder. Waves of sadness, brief illusions, preserve function, point to normal grief. Normal grief comes in waves of sadness, can include brief allations of the deceased hearing their voice, and preserves the person's ability to function, gradually easing over months. Because she knows he is gone, is caring for herself, and is resuming activities, this is normal bereavement, not a disorder. The correct answer is major depressive disorder involves pervasive, persistent symptoms such as worthlessness and marked functional impairment beyond the waves of normal grief, which she does not show. Choice or wrong. Complicated prolonged grief is diagnosed when intense grief persists and impairs function for many months to over a year, not at 3 weeks. Choice. This is normal grief. Which stage of the theoretical stages of change model is he in? A patient who smokes says, I know I need to quit and I'm planning to start quitting within the next month. I'm figuring out how I'll do it. Read the command. The stage for someone planning to act soon. Intending to act within a month is preparation. In the stages of change model, preparation is when a person intends to act in the near future, typically within a month, and is planning concrete steps. This smoker has committed to quitting soon and is working out how, which places him squarely in preparation, one step before action. The correct answer is A. Contemplation is thinking about change but without a commitment to act in the near term, whereas this patient has set a 1-month timeline and is planning. Choice C, wrong. Action is actively carrying out the change, but he has not yet stopped smoking. Choice D, wrong. Planning to quit within a month is the preparation stage. What does this triad describe? A resident describes feeling emotionally drained and exhausted, increasingly cynical and detached toward her patients, and a shrinking sense of personal accomplishment at work. Read the command. The triad of exhaustion, cynicism, low accomplishment, that is burnout. PHY session burnout is defined by a triad: emotional exhaustion, depersonalization, cynicism, and detachment toward patients, and a reduced sense of personal accomplishment. It is driven by chronic workplace stress and is distinct from a primary mood disorder, though the two can overlap and burnout can lead to depression. The correct answer is D. Major depression is a pervasive mood disorder affecting all areas of life, whereas burnout is tied specifically to the work context and its 3 characteristic features. Choice or wrong. Generalized anxiety disorder centers on excessive worry across many domains, not the exhaustion, cynicism, accomplishment triad. Choice E, wrong. This triad describes physician burnout. That's the plot. 40 of the highest yield ethics scenarios, the one showing up more every year. 60 seconds to lock the rules. Consent needs a capable, informed, willing patient. Emergencies imply it. A patient can even waive the right to be informed. A designated proxy outranks the next of kin. Decide as the patient would when wishes are known. Use best interest when they are not. Minor self-consent for the sensitive exceptions, but parents can never refuse life-saving care for their child. Report suspected child abuse. No proof needed. DNR limits only resuscitation. Withdrawing unwanted treatment, including artificial nutrition, is a patient's right, not euthanasia. Be transparent, disclose conflicts and errors, report impairment, and never cross the boundary with the current patient. Train process, not memorization. StepLogic. Learn how to think, not memorize. Next up, the final piece, communication skills and behavioral science.